Corazon, Locsin, Montelibano Memorial Regional Hospital started with 25 beds 96 years ago. Although it closed temporarily during World War II, it expanded to become a training hospital in 1962. Its bed capacity increased to 400 in 1981 and was subsequently reclassified into a regional hospital in 1984. It served as a refuge for hundreds of malnourished children during the Negros famine in the years that followed. The growing population, poverty incidence of 21.9%, and poor governance pushed the ailing health facility beyond its capability to respond to the growing needs of over 3 million people.
We were once labeled and tagged as the sick boy of the Department of Health. However, that moniker, hindi po namin nakakalimutan. Ika nga, there's a saying that yung taong hindi marunong tumingin sa pinanggalingan ay walang patutunguhan. But we do not put those things all under the bridge. Rather, we took it as a challenge, learn from our past, no revisionism of history. Looking back, that's almost 10 years ago. We found that Corazon Locsin has one of its greatest assets, and that is the human resource. Tapping everyone's potential resulted into the creation of 14 clinical departments. 13 of them has been accredited training program. And we move forward as the years pass as part of our restructuring and reengineering of the biggest resource that we have, which is the organization. And 7 years ago, we started our roadmap towards standardization. With that, we are now ISO 9001-2015 ISO certified. Several awards was awarded to Corazon Locsin. To name a few, I believe, being the head of this organization, that the biggest one was the DOH Star Awards in 2019, wherein we were accorded as one of the top 10 hospitals in the country. Philippine Hospital Association Outstanding Hospital Award in 2019, as well as Most Outstanding Hospital in 2020. Others are Philippine Hospital Association Annual Recognition Awards as the best in practices in antimicrobial stewardship program, and Government Best Practices Recognition in 2019 in Anesthesia Care Program and Antimicrobial Stewardship Programs. So where do we go from here? It's like any other organization. We always aspire and dream to be better. There's a saying that goes, there's no crime against dreamers, and that is our dictum. The awards, recognitions, and certificates were not enough. We recreated our vision and mission statement to adapt to the present situation. And we envision ourselves to be a premier tertiary healthcare training, teaching, and research facility, at the forefront of excellent, responsive, and people-centered health services. We continually improve good governance and participatory leadership. Having said that, our mission is to provide excellent and people-centered tertiary healthcare services that are accessible, safe, equitable, affordable, and responsive through adequate generation of resources, continual improvement and upgrading of facilities, training and empowerment of human resources, and to utilize relevant resources and effective networking with other institutions. Where do we put ourselves in the next couple of years? The organization has defined its strategic position to be people-centered, training and teaching and digitalized 1,000-bed hospital and research facility with 14 residency and 3 fellowship programs. To name a few, residency, training in physical and rehab medicine on 2024, fellowship and training in gastroenterology by next year, and 3 years from now, fellowship training in oncology. Having mentioned that, through the Department Order 2021-001, CLMMRH, the Center for 11 Specialty Care, and these are brain and spine care, burn care, cancer care, cardiovascular and geriatric care, infectious diseases and tropical medicine, orthopedic, renal and transplant care, toxicology center, trauma care, and neonatal care. The challenges that organization had to go through as the end of referral hospital for the severe and critical cases of COVID-19 in the island of Negros. I believe that March 2020 pandemic, and up to now we are still experiencing it, made us define our own character. And I believe that with this strategic position, we can attain this in the next few years to come. The question now is, how did we choose this strategic position? Having on the background our experience in adapting and coping with the pandemic, which largely influenced our strategic position. To name a few, the socio-economic difficulties, the worsening health care due to poverty, delays in non-reimbursement of bill health claims, and the ever-increasing poorer households and birth rate. These are the factors we choose this strategic position. So now, how do we attain our dreams and desired transformation? We divided this into 3 strategies, to name it: the patient care roadmap, the infrastructure and equipment roadmap, and people safety roadmap. But let me go back to a little detail in relation to the 3 strategies, and one is the patient care roadmap. The 11 specialty centers will respond to the top 10 causes of morbidity and mortality in the region. To name this, these are upper respiratory tract infection, pneumonia, hypertension, injuries of all forms, bronchitis, urinary tract infection, tuberculosis of all forms, acute watery diarrhea, diabetes mellitus, skin diseases of all forms. This will give the community a better chance of equitable access to specialist care, which are not available majority in our area of responsibility. Next is our infrastructure and equipment roadmap. Coupled with those morbidity and mortality cases in the region, we plan to implement this infrastructure and equipment program by resuming the construction of the state-of-the-art East Tower facility, which will house most of this subspecialty capability building. We also increase our capacity to accommodate the ever-growing population of the region. And lastly, the people safety roadmap, not only directed towards our clients, but also safety of the operators. The pandemic has taught us a lot of lessons, and the organization has adopted the Target Zero hashtag as a testament to our commitment to protect healthcare workers. Also, the only government agency under the Department of Health to be accredited with the Environmental Management Safety Accreditation, which was awarded to us last March of 2022. And this is, technical term is the ISO 14001 series of 2015. And we hope by 2025 to be accredited in occupational health and safety in the next couple of years. What have we done so far as an organization? On top of the quality and environmental management office system, we created the Office of Strategy Management to link the different strategy formulation with strategy execution. It is a team committed individuals with primary goal of navigating the organization towards our aspiration. We also utilize the power of social media in information dissemination through our Horizon page, YouTube channel, in order to engage the whole organization about these strategies. Number 2, the management committee also created the specialty centers as units, departments directly under the Office of the Chief of Medical Professional Staff to empower them to develop their respective services, capability, and hold them accountable of their performance. Three, we also laid down a series of capacity building activities to enable our managers to cope with these changes. To name a few, we have engaged Philippine Heart Center for our Office of Strategic Management benchmarking program and observership sometime around June. Likewise, the implementation of digitalization in offices and different areas with a primary focus on patient services was also developed. We have upgraded our hospital information system to cope up with the new demands for information technology. We have also created last year our outpatient department teleconsulta, and this will be handled by our trained and qualified staff, as well as develop a dedicated telemedicine or teleconsulta room, which the Department of Health provided the needed infrastructure outlays. Moving forward and looking at the future, the organization of CLMMRH shall make its beginnings and past experiences as its motivators in moving forward. We have also developed our short-term, medium-term, and long-term strategy to make these programs viable. For our short-term action plans in the next 12 months, we will endeavor and improve the organization awareness of these strategies to at least 95% through our different communication channels. Number two, for our medium-term action plans, we will implement by 2024, thereabouts, and I can summarize it with the acronym RISE or RISE. R for to renavigate or adjust the Corazon, Locsin, Montelibano Memorial Regional Hospitals operations due to the economic recession as a result of COVID-19 pandemic. Redesign the organizational structure to match the staffing pattern of 1,000 bed capacity and streamline governance mechanism. I for inspire the people for more commitment and leadership by example on the different level managers in the organization. S is to sustain the governance in education and training program of the Office of Strategic Management and integrate the strategic performance commitments as part of the internal quality audit monitoring. And lastly, letter E is empower and engage the local government units through Office of Strategic Management, multi-sectoral governance council, coordinating committee, and employees empowerment. For the long-term action plan, which we envision it to have all of these requirements completed in the next 5 to 6 years, to ultimately aim to build a culture of stewardship of resources that translate to completed projects, digitalization of processes, increase in capacity and capability and of the new services.
CLMMRH has survived the war, famine, and the pandemic. As long as its people, the heart of the organization, is guided, inspired, and empowered, CLMMRH shall brave the complex problems of the new normal. It will no longer be remembered as a sick boy of DOH because CLMMRH will rise.